Hello everyone, my name's Iman. Welcome back to my YouTube channel. Today we're going to tackle a practice problem set that relates to our lecture on the respiratory system. Let's go ahead and get started with problem number 1. Problem number 1 says all of the following facilitate gas exchange in the lungs except blank. Let's work through the answer choices. A says thin alveolar walls. Now this definitely helps gas exchange. If you remember from our lecture, alveoli are surrounded by capillaries, and both the alveolar wall and the capillary wall are only 1 cell thick. So this creates very short diffusion distance, which allows oxygen and carbon dioxide to move across quickly and efficiently. B says multiple subdivision of the respiratory tree. This is also true. The branching structure increases surface area, which is a key feature of effective gas exchange. More surface area means more opportunity for gases to diffuse. So far, A and B are correct statements. Let's read C. C says differences in the partial pressure of oxygen gas and carbon dioxide gas. This is absolutely essential. The entire process of gas exchange is driven by concentration gradients, also known as differences in partial pressure. Oxygen flows into the blood and carbon dioxide flows out because of these gradients. D says active transporters in alveolar cells. This one stands out. Gas exchange in the lungs, it occurs through simple diffusion, not active transport. There are no pumps or active transporters involved. Gases like oxygen and carbon dioxide, they move passively from areas of high partial pressure to areas of low partial pressure. So the only statement that's incorrect here is D. 1 is D. Let's move on to problem 2. Problem 2 says, which of the following associations correctly pairs a stage of respiration with the muscle actions occurring during that stage? For this problem as well, we're going to work through each answer choice. Remember, we're looking for a correct association. A says inhalation and diaphragm relaxes. This one is incorrect. During inhalation, the diaphragm contracts, not relaxes. When it contracts, it's going to flatten and move downward, and that will increase thoracic volume so that air can enter the lungs. Relaxation of the diaphragm occurs during exhalation. B says inhalation, internal intercostal muscles contract. This is also incorrect. Internal intercostal muscles are used during active exhalation, where they pull the rib cage down and in to push that air out. They're not involved in normal inhalation. So again, A and B so far, incorrect associations. C says exhalation and diaphragm contracts. This one is backwards. During exhalation, the diaphragm relaxes. It only contracts during inhalation. Finally, D says exhalation and external intercostal muscles relax. This is the correct answer. During passive exhalation, the external intercostal muscles, they relax, and that's going to allow the chest wall to return to its resting position. This, along with the diaphragm relaxation and the lung recoil, really helps push air out of the lungs. So the correct answer for problem 2 is D. Problem 3 says, total lung capacity is equal to the vital capacity plus the blank. A says tidal volume, B says expiratory reserve volume, C says residual volume, and D says inspiratory reserve volume. Total lung capacity, or TLC, represents the maximum amount of air that your lungs can hold when you've inhaled as deeply as possible. So it includes everything, air you can move in and out, and air that remains no matter how hard you try to exhale. Now think about vital capacity, or VC. That's the volume of air that you can actively move in and out. It includes 3 parts: your tidal volume, which is your normal breaths, your inspiratory reserve, which is extra air you can inhale after a normal breath in, and your expiratory reserve, which is extra air you can push out after a normal breathe out. But there's one final portion of air that stays in the lungs no matter what, and that's your residual volume. This air keeps the alveoli inflated, and it allows for continuous gas exchange even between breaths. So if you add vital capacity, everything you can move, plus residual volume, what stays behind, you get the total lung capacity. That makes the correct answer here C, residual volume. Problem 4 says, the intrapleural pressure is necessarily lower than the atmospheric pressure during blank. A says inhalation because the expansion of the chest cavity causes compression of the intrapleural space, decreasing its pressure. B says inhalation because the expansion of the chest cavity causes expansion of the intrapleural space, decreasing its pressure. C says exhalation because the compression of the chest cavity causes compression of the intrapleural space, decreasing its pressure. And finally, D says exhalation because the expansion of the chest cavity causes expansion of the intrapleural space, decreasing its pressure. When you inhale, your diaphragm contracts downward and your external intercostal muscles lift the rib cage up and out. These muscle actions are going to expand the thoracic cavity, which is the space inside your chest. Now remember, the intrapleural space is that narrow, fluid-filled space between the lungs and the chest wall. When the chest expands, it pulls on the intrapleural space and it's going to increase its volume. And from Boyle's law, which we know from general chemistry, if volume increases, pressure decreases because there is an inverse relationship between volume and pressure. So the pressure in the intrapleural space drops, it becomes lower than the atmospheric pressure. This drop in pressure is what allows the lungs to expand. Air rushes in because the lungs are now under negative pressure relative to the outside. That means that the correct answer for problem 4 is B, inhalation, because the expansion of the chest cavity causes expansion of the intrapleural space, decreasing its pressure. Problem 5 says, a patient presents to the emergency room with a stab wound to the left side of the chest. On a chest x-ray, blood is noted to be collecting in the chest cavity, causing collapse of both lobes of the left lung. The blood is most likely located between blank. Okay, let's repeat what we know. We're told that the patient has a stab wound to the left chest. And on the chest x-ray, blood is collecting in the chest cavity, and that's causing the collapse of both lobes of the left lung. Now, this tells us a few key things. First, blood is entering a space it normally shouldn't be in. And second, the lung is collapsing, which means air can't enter properly, and that space is now disrupted. For the lung to collapse, the negative pressure that normally holds the lung expanded, that's been lost. That negative pressure, it exists in the intrapleural space. This lies between the parietal pleura, which is the lining of the chest wall, and the visceral pleura, which covers the lung itself. So if blood is collecting there between these two pleural layers, it disrupts that pressure gradient and it causes the lung to collapse. That's exactly what this case describes. Therefore, the blood is most likely located between the parietal and visceral pleura, which is answer choice B. Let's move on to problem 6. Problem 6 says, each of the following statements regarding the anatomy of the respiratory system is true, except blank. You guys already know what we have to do here. We have to go through each answer choice. A says the epiglottis covers the glottis during swallowing to ensure that food does not enter the trachea. Now, this is a correct statement. The epiglottis is a flap of tissue that folds down to block the airway while swallowing, and it's going to prevent food from entering where it should not enter. B says the trachea and bronchi are lined by ciliated epithelial cells. This is also correct. These cilia play an important role in the mucociliary escalator, and they help move mucus and trapped particles up and out of the respiratory tract. So far, A and B are true statements. Let's read C. C says the pharynx contains two vocal cords, which are controlled by skeletal muscle and cartilage. This is our incorrect statement. The vocal cords, they're located in the larynx, not the pharynx. The pharynx is a shared pathway for food and air, and it does not house the vocal cords. So problem 6 is C, but we're still going to read answer choice D. D says the nares are lined with vibrissae, which help filter out particulate matter from inhaled air. This is correct. Vibrissae are the coarse hairs at the entrance of the nasal cavity that help trap debris. So once again, the correct answer is C because it incorrectly places the vocal cords in the pharynx rather than in the larynx. Let's move on to problem 7. 7 says, which of the following is a correct sequence of passageways through which air travels during inhalation? So let's walk through the proper anatomical path. Air enters through the nose or mouth, and then it moves to the pharynx, which is a common passageway for both air and food. From there, air passes into the larynx, which houses the vocal cords, and it serves as the entry point into the respiratory tract. After that, air moves into the trachea or windpipe, which is the main conducting airway. The trachea then divides into the bronchi, which divide off into the lungs. Within the lungs, the bronchi further divide into smaller bronchioles, and finally, air reaches the alveoli, which are the thin-walled sacs where gas exchange occurs. So with that path, we can correctly identify that the correct answer for problem 7 is D. Problem 8 says, idiopathic pulmonary fibrosis, IPF, is a disease in which scar tissue forms in the alveolar walls, making the lung tissue significantly more stiff. Which of the following findings would likely be detected through spirometry in a patient with IPF? Statement 1 says decreased total lung capacity. Statement 2 says decreased inspiratory reserve volume. And statement 3 says increased residual volume. IPF is a restrictive lung disease, meaning the lungs lose elasticity and they become stiff due to the scarring in the alveolar walls. This is going to reduce the lung's ability to expand fully. And as a result, we'd expect a decrease in inspiratory volumes since the patient can't inhale as deeply. Let's keep that in mind and let's go through each option. The key to answering this problem is not really understanding what IPF is, it's understanding the uses and limitations of spirometry. 1 says decreased total lung capacity. Now, while this is true of restrictive diseases in general, total lung capacity is going to include residual volume. And if you remember from lecture, residual volume can't be measured directly by spirometry. So although the total lung capacity may be reduced in this condition, spirometry can't confirm that on its own. So statement 1 is not what we're looking for. Statement 2 says decreased inspiratory reserve volume. This can be measured by spirometry. It's the extra volume of air that you can inhale after a normal breath. In IPF, this value would be reduced because the lungs can't expand easily. So statement 2 is correct. 3 says increased residual volume. Residual volume is the air that's left in the lungs after you do your maximal exhale, and this tends to increase in obstructive diseases, not restrictive ones. And again, the important takeaway here is residual volume isn't measured by spirometry. So the only change among these that can be detected is going to be inspiratory reserve volume. So statement 2. That makes the correct answer for problem 8B. Problem 9 says, studies have indicated the premature babies are often deficient in lysozyme. What is a possible consequence of this deficiency? This question is about lysozyme, an enzyme that's found in many secretions of the respiratory tract, including the mucus and tears. It plays a really important antibacterial role, and it does this by breaking down the peptidoglycan layer in bacterial cell walls, especially in gram-positive bacteria. Now, in premature infants, if the lysozyme levels are low, this is going to weaken the innate immune defense in the respiratory tract. Without this protective enzyme, harmful microbes are more likely to colonize or infect the airways. So with this in mind, let's go through the answer choices. A says respiratory distress and alveolar collapse shortly after birth. Now, this is actually more related to a deficiency in surfactant and not lysozyme. So this is not what we're looking for. B says increased susceptibility to certain infections. Now, this is absolutely correct because lysozyme helps destroy bacteria and its absence can increase infection risk. 9 is B, but we're still going to work through C and D. C says inability to humidify air as it passes through the nasal cavity. Now, this is unrelated to lysozyme. Humidification is a physical function of the nasal mucosa, not an enzymatic one. So this has nothing to do with the enzyme of interest. D says slowing of respiratory rate in response to acidemia. This is going to involve chemoreceptor function and central respiratory control. This is not related to our enzyme of interest. So again, incorrect. The best answer here is B, increased risk of infection due to reduced antimicrobial defense. Problem 10 says some forms of pneumonia can cause an excess of fluids such as mucus or pus to build up within an entire lobe of the lung. How will this affect the diffusion of gases within the affected area? A says carbon dioxide can diffuse out, but oxygen will not be able to enter the blood. B says oxygen can diffuse into the blood, but carbon dioxide cannot diffuse out. C says no change in diffusion will occur, and D says no diffusion will occur in the affected area. Now, in healthy lungs, the alveoli are air-filled sacs with thin walls where oxygen diffuses into the blood and carbon dioxide is going to diffuse out. However, in pneumonia, fluids such as mucus or pus, they can accumulate within the alveoli of a lobe. And this buildup is going to disrupt the air-blood interface, and it's going to make it difficult for gases to move across. When the alveolus is filled with fluid, it's essentially going to become non-functional for gas exchange. Both oxygen and carbon dioxide diffusion are going to be severely impaired, and there's no clear path for oxygen to enter or for carbon dioxide to exit. So keeping that in mind, the correct answer is going to be D. No diffusion is going to occur in the affected area. Problem 11 says, some people with anxiety disorders respond to stress by hyperventilating. It is recommended that they breathe into a paper bag and then rebreathe this air. Why is this treatment appropriate? A says hyperventilation causes an increase in blood carbon dioxide, and breathing the air in the bag helps to readjust blood levels of carbon dioxide. B says hyperventilation causes a decrease in blood carbon dioxide, and breathing the air in the bag helps to readjust blood levels of carbon dioxide. C says hyperventilation causes an increase in blood oxygen, and breathing the air in the bag helps to readjust blood levels of oxygen. And finally, D says hyperventilation causes a decrease in blood oxygen, and breathing the air in the bag helps to readjust blood levels of oxygen. Hyperventilation means breathing too rapidly and deeply, and that's going to cause you to exhale more carbon dioxide than normal. So as a result, blood carbon dioxide levels drop. This is going to lead to respiratory alkalosis, which is a rise in blood pH that's going to cause symptoms like dizziness or even fainting. Now, breathing into a paper bag helps trap your exhaled air, which contains a higher concentration of carbon dioxide. And rebreathing this air helps restore carbon dioxide levels in the blood, which will correct the alkalosis and relieve your symptoms. So the correct answer here is B. Hyperventilation causes a decrease in blood carbon dioxide, and rebreathing carbon dioxide from the bag helps normalize the levels. Let's move on to problem 12. Problem 12 says a patient presents to the emergency room with an asthma attack. The patient has been hyperventilating for the past hour and has a blood pH of 7.52. The patient is given treatment and does not appear to respond, but a subsequent blood pH reading is 7.41. Why might this normal blood pH not be a reassuring sign? Okay, so the patient initially presents with a blood pH of 7.52. This tells us that they're in a state of alkalemia. That makes sense if they've been hyperventilating, because when someone breathes too rapidly, they exhale too much carbon dioxide. And since carbon dioxide contributes to the acidity in the blood, losing too much of it shifts the pH upward and makes the blood more basic. Now, here's the key detail. The patient doesn't improve clinically, but their pH does drop to 7.41, and that's technically within the normal range. Normal blood pH falls between 7.35 and 7.45. But that change is actually not very reassuring. Let's think about what that pH drop really means. If the patient started off in alkalosis due to hyperventilation, and now the pH is coming back down without clinical improvement, that suggests that they're no longer ventilating as effectively. In other words, they may be starting to retain carbon dioxide, which is acidic, and that's what's pulling the pH back towards normal. But this isn't a sign of recovery, it's actually a warning. It suggests the respiratory muscles are tiring out and ventilation is beginning to fail. The body, it's no longer able to maintain the elevated respiratory rate that was driving alkalosis, so carbon dioxide starts to accumulate again. So even though the pH looks normal, it's actually a sign of decompensation. The patient is deteriorating, not improving, and that's why the correct answer here is going to be C. The patient may be descending into respiratory failure. Problem 13 says, premature infants with respiratory distress are often placed on ventilators. Often, the ventilators are set to provide positive and expiratory pressure. Why might this setting be useful for a premature infant? A says premature infants lack surfactant. B says premature infants lack lysozyme. C says premature infants cannot thermoregulate. And D says premature infants are unable to control pH. First, let's pause and remember what we know about the lungs and breathing mechanics. In a normal, healthy lung, the alveoli, those tiny air sacs, they stay open during breathing, and that's largely because of a substance called surfactant. We talked about this in lecture. Surfactant reduces surface tension in the alveoli, and that's important because without surfactant, it would collapse after each breath, and reinflating them would take a lot more effort. Now, in premature infants, especially those that are born before about 30 weeks of gestation, the lungs aren't fully developed yet, and they don't produce enough surfactant. That means their alveoli are much more likely to collapse at the end of exhalation. So when they breathe out, the air sacs close, and then when they try to breathe in again, they have to work much, much harder to open them back up. And that makes breathing really inefficient and exhausting for that poor premature baby. So then the question becomes, how does positive end expiratory pressure help? The idea behind this is that it keeps a little bit of pressure in the lungs even after the baby exhales. So instead of the alveoli collapsing completely, they're held slightly open. And that's really important in premature infants, again, who don't have surfactant. So with that in mind, the best answer becomes really obvious. 13 is A. Problem 14 says, in emphysema, the alveolar walls are destroyed, decreasing the recoil of the lung tissue. Which of the following changes may be seen in a patient with emphysema? When the walls between alveoli break down, not only is surface area for gas exchange reduced, but also, and this is important, the recoil of the lungs is decreased. Now let's pause here and remember, healthy lungs have elastic recoil. This recoil is what helps push air out when you exhale. But in emphysema, that recoil is weakened because of the loss of elastic tissue. So what happens? The patient can inhale, but they have trouble exhaling fully. And that leads to air trapping. Since they can't push all of the air out, more and more and more air starts to accumulate in the lungs. And that gives us a clue to the correct answer. So let's work through the choices. A says increased residual volume. Yes, that's exactly what we would expect. Residual volume is the amount of air left in the lungs after you exhale. And in emphysema, since exhalation is impaired, more air gets trapped. So residual volume increases. That's our answer. 14 is A. We're still going to work through B, C, and D. B says decreased total lung capacity. Now that sounds tempting, but it's actually the opposite. In emphysema, total lung capacity can actually increase because the lungs become hyperinflated. They're holding more air, not less. It's just that the air isn't being exchanged properly. C says increased blood concentration of oxygen. That wouldn't make sense here. Emphysema impairs gas exchange, so oxygen levels actually decrease. Finally, D says decreased blood concentration of carbon dioxide. Again, not likely. If exhalation is impaired, carbon dioxide tends to build up in the lungs and blood, so carbon dioxide levels usually rise, not fall. Based on our reasoning, the best and most scientifically supported answer here is A, increased residual volume, and we arrived at that by understanding how emphysema affects lung recoil and leads to air trapping. With that, we can move into our last and final problem for this set. Problem 15 says, allergic reactions occur to an overreactive immune response to a substance. Which cells within the respiratory tract play the largest role in the generation of allergic reactions? To answer this problem, let's review mast cells. Mast cells are immune cells that reside in mucosal tissues, including the lining of the respiratory tract. Their job is to act as early responders to potential threats. They help defend the body against pathogens and foreign invaders. But in some people, they also react to harmless substances like pollen or dust, which we call an allergic reaction. Now, what makes mast cells especially important is they are coated with antibodies. And these antibodies are already bound to the surface of the mast cell, so the cell is essentially primed and waiting for something to bind. If a person is sensitized to an allergen, let's say pollen, and they inhale that allergen, The substance can bind directly to the antibodies that are already attached to the mast cell, and that binding event is going to trigger the mast cell to activate. Once it's activated, it's going to release inflammatory molecules that lead to the symptoms we associate with an allergic reaction. So while mast cells play a very important role in general immune defense, their role in initiating overactive immune responses to harmless substances is exactly what makes them central to respiratory allergies. So what we're looking at in this problem is C. The correct answer for 15 is C. And with that, we've completed this practice problem set. I hope it helps. Please let me know if you have any questions, comments, concerns down below. Other than that, good luck, happy studying, and have a beautiful, beautiful day, future doctors.